everyone. So in this video we are going to study about spasm of accommodation that can be drug induced or spontaneous. The drug induced are because of muscarinic drugs. These drugs like pilocarpine bind over the receptor in the ciliary muscle causing spasm of ciliary muscle, and this spasm will result in relaxation of the zonules as occurs in accommodation, but everything will be aggravated, okay, and there will be the curvature increase in the lens, okay, and it will relax, but here there will be more bulging of the lens, and this more bulging of lens will result in a characteristic induced myopia seen in the case of spasm of accommodation. Means divergent rays that in the case of a normal accommodation focus over the retina. In this case they will focus before they reach retina. This is because of highly increased power of lens, because of its increased curvature, that is because of spasm of accommodation. So this is the drug induced case of a spasm of accommodation, whereas spontaneous are generally seen in children who already have a refractive error, and they by themselves are compensating for the refractive anomaly, okay, like while they are doing near work or in a bad illumination or their reading position. These all affect the accommodation, okay, and plus the anxiety and stress are an important factors that are responsible for a spontaneous spasm of accommodation. So, okay, so here the patient will have clinical feature of induced myopia, that there will be far-sightedness defect suddenly when the spasm onset, and there will be asthenopic symptoms, meaning the patient will have pain in eye which will be relieved by closing the eyes tightly. He will have frontal headache and eye strain, okay, that is the common name for asthenopic symptoms. The treatment here include use of cycloplegic drugs to relieve the spasm of the muscle, okay, so atropine is used here in the children's because it is a powerful cycloplegic, and we advise the patient to avoid near work as much as possible for at least 1 week post the spasm episode. And in the cases the it was a spontaneous spasm of accommodation, the child must, if the on factor was anxiety or stress, the child must be evaluated and be given psychotherapy. So this is what we needed to remember about this condition. Thanks for watching.